there is something I usually say that you are the best security when it comes to your health. No other person can take care of you than you yourself, actually. So no matter how you try, or we try in the hospital to even look at these patients or to help them, we can't do more than they do for themselves. So that's why sometimes you even have a patient who is having severe hypertensive crisis, and because this person is already addicted to smoking, he still wants to smoke. Like I said, you can, most of the times you can only advise, sometimes you can only try, and sometimes you can actually go against medical advice to do what they feel like they want to do. So, like I said, you are the best security to your health. So no one can actually do more for you than you do for yourself.
Welcome back to the Balance It podcast. This is a platform where we have all conversations about wellness, purpose, personal development, and lifestyle in general.
And in today's episode, we are so honored to have a gentleman on board with us. As you can see him, he will definitely introduce himself later. Yes, we will be having a conversation on hypertension. Do you guys know what hypertension is? I bet you don't know. So if you don't know, stick to it until the end. But also if you know as well, just stick with us. Definitely there is something you're going to get out of it. I am your host. I am Eda Onyoni.
And I'm Gertrude Nasike. So we'll begin with few fire questions.
Okay.
Yes, just to make you acquainted with our audience as well.
All right, that's fine.
So why do you like singing?
Well, I can't think if I don't think I can do anything without music. I really love singing right from when I was a little child. Not like a little child like that, but music is one of the things that I know I can do whenever I'm angry. I listen to music, I sing, and it makes me happy. So I don't think I can go a day without singing. Yeah.
Wow. And also, what inspires you the most?
Okay, I would say passion for health, good health inspires me, and music inspires me, of course. And I would say my goals, my aims, those are the things that actually keep me going. Those are the things that inspire me a lot. When I look at the things I need to achieve, when I look at the barriers I need to how do I say, most barriers that people encounter on daily lives, when I look at how I need to push those barriers away, those are goals, those are aims, those are the things that really inspires me generally. So, but number one is good health. Passion for good health is actually one thing that inspires me. Yeah.
Wow, and it's a good thing we'll be speaking about that today.
Yes.
Yeah, and lastly, what can you do without?
What can I do without?
What can you not do without?
Oh, what can I? I can't do without music, of course. I can't do without football. I love playing and watching football at the same time, and I love. I can't do without, of course, my career as a nurse and a health professional. I can't do without those things. Yeah, so that's it for me.
It was really great hearing that from you. So you can just introduce yourself.
Okay.
Maybe tell us who you are, what you do, and maybe where you come from as well.
Okay, thank you. My name is Umejiego Chimezie, and I'm from Nigeria, the eastern part of Nigeria, and I'm a nurse, a registered nurse in Nigeria, and also I'm a midwife. And I'm currently doing my master's in advanced nurse practitioner and in specialty of ICU, so intensive care unit. So that's it basically.
Wow.
For a start.
You now understand why you have kids seated on this seat.
Yeah, we definitely are bringing you experts, you can say. So to start us off, would you just tell us a bit about hypertension, like what is hypertension and anything around it that you would want to?
Well, hypertension is as old as man. Everybody alive literally have heard of hypertension. Most persons that haven't heard of hypertension must have heard of high BP. because some person knows it as hypertension, some person knows it as high BP, which is high blood pressure. And most cases we see hypertension as a silent killer, because actually hypertension is a silent killer. And most fact about hypertension is, the most important thing is, it is a silent killer and it has no cure, but it can be managed. Yes. Hypertension has no permanent cure, but it can be managed for as long as the person lives.
Why is it referred to as a silent killer?
Yeah. Well, it is referred to as a silent killer because most times you see people have hypertension and they don't have the symptom. Those are the people we call asymptomatic patients. These patients don't have the symptoms of hypertension, but at the same time they have this high pressure on their arteries, on their blood vessels, that can literally cause a stroke, like a hemorrhagic stroke by a rupture of an artery, a major artery in the brain or somewhere around the blood vessels, a major rupture. And this person don't plan for this. It just happens. You can be walking on the road and then suddenly it happens. So it's really a silent killer because you don't feel this. Most persons don't feel these symptoms when they come. They don't see the signs, but it's there. Except maybe when they go for some medical check and they see that, okay, you really have a high blood pressure. Why? And then they look at it, they start taking it into consideration, and that's it. So that is why hypertension is seen as a silent killer. Yeah.
That's overwhelming already because we might be seated here and we don't know. We have not gone to a checkup. Like somebody can be just at home and something happens, they don't know what exactly, but guys, we need to go for checkups. We need to go for checkups. So maybe you can tell us what are these things that cause this hypertension or the high blood pressure.
Okay, before I go to the causes, I would like to talk about two most important things. I'll talk about what we call anatomy and what we call physiology. Anatomy is when we look at the structures, the organs that are involved in this particular thing, and physiology is when we look at the functions. So from anatomy point of view, we see the heart, which is the center, and then we see the blood vessels, the arteries, the veins. These are organs or structures that are involved in hypertension per se. And then we look at the physiology and how the blood pressure come about before we talk about what causes high blood pressure. So now, hypertension, the causes for this hypertension sometimes are unknown. Sometimes in medical terms, we look at it as idiopathic. There is no cause. But then when we divide it into primary and secondary, we can now see the risk factors that causes hypertension. So basically, you can say there is no known cause of hypertension. But then, if you look at it from primary and secondary point of view, you can now see that hypertension have risk factors. These are the things that causes hypertension or that can predispose a person to hypertension. So from primary point of view, we have 95% people on earth who suffer primary hypertension. Yeah, 95%.
It is like among them.
What do you mean among the 5%? How do
When we classify hypertension based on the risk factors, primary and secondary. For primary, we have more than secondary. So primary are 95% and secondary 5%. What do I mean? In primary, we look at those risk factors like excessive alcoholism, we look at smoking, we look at genetic factors like hereditary, because it can be that your mom had hypertension and growing up, middle age, you start experiencing these symptoms of hypertension. So genetic factor is also one of the major causes of hypertension, or one of the major risk factors in primary hypertension. So we look at excessive alcoholism. Now, obesity is one factor that also causes primary hypertension. Now we look at lifestyle, sedentary lifestyle. Lifestyle is a major cause of hypertension, primarily, actually. Then we also look at diet, what we eat, food that contain lots of sodium. All these are things that causes primary hypertension. There are people that like salty food. There are people that eat things that contain lots of sodium. Now, I might not really talk about the physiology of that because it might be too complex and all, but then sodium has the tendency of retaining water. You understand?
Yeah.
And wherever there is sodium, there is water. And when there's so much accumulation of water, fluids, we call it fluid, I just say water for basic terms, we call it fluid. When there's so much accumulation of fluid in the body, it causes overload. The overload can go to the chest region, it can go to the heart, and then it increases the blood pressure.
Okay.
Do you understand?
Yeah,
So that is why what sodium does in that aspect. So then if we look at the secondary now, secondary hypertension, the reason why it is 5% is because it occurs as a result of organ problems, underlying disease conditions. You can see someone that has a renal problem, a kidney problem. Because of the kidney problem, there is hypertension. You can see someone that has a brain tumor, like a cancer, any chronic disease or illness in the body that can result to hypertension. That is why it is called secondary. And that is why it's 5%, because of course it's only when you have chronic illnesses that you can have hypertension. But for primary, the reason it's more is because there are so many things that causes it. There are so many factors that predisposes one to this hypertension. That is why we have primary 95% and secondary 5%. So these are the things that we look at as the causes of hypertension. But if we were to ask, does hypertension have a particular cause? We say there is no known cause. But then we can now categorize it primary and secondary. So for primary, these are the causes: lifestyle. There's some persons that take some drugs, medication, of course. Abuse of medications can cause hypertension as well. Yes. Then alcoholism, smoking, poor dieting, and obesity. These are primary causes of hypertension, and of course, genetic factor. Yeah. Thank you.
Just when we're still on the risk factors, do we have maybe a risky age group that is more prone to this?
Yeah, of course. Yeah, there's a risky age group. Of course, we know the aged people. Age can also be a cause of hypertension because you look at the age when they get to, they start advancing towards the old age. You see them start having some symptoms of hypertension as well. And these are because, of course, the body as we age, it becomes degenerative. It goes, like most of these organs becomes degenerative. And because of that, they don't function in their full capacity like they used to before. So it can cause hypertension as well. Yeah.
Okay. So what are some of the complications that arise from hypertension?
There are so many complications that can arise from hypertension. We look at poor organ function. Other organs can be affected by hypertension. We look at stroke. Stroke is one major complication of hypertension because when the pressure is so much on the walls, on the arteries, because with the blood pressure basically can be determined by the cardiac output and the peripheral resistance, and of course the elasticity of these arteries. When we talked about the anatomy, I said we look at the heart and the blood vessels. Now, when we look at the physiology, we look at cardiac output. Now, the heart is supposed to pump with each beat. It pumps blood with each heartbeat. Now, when the heartbeat is faster than normal, or it pumps more blood with each beat, then there is increased cardiac output. Now, also, when this heart is pumped, when the blood is pumped into these vessels, is the vessel narrowed? Most of these vessels, if they are smaller than it is supposed to be, it causes so much resistance on those vessels, and it can also increase the blood pressure. Now, for peripheral resistance, why it can cause a major complication in hypertension is this. Now, the heart supplies blood to organs, to different organs, the kidney, the liver, so many organs of the body. And now, when there is this resistance in the blood vessel, blood doesn't go, enough blood supply doesn't go to those organs. And of course, let's take for example, the kidney is here, it needs the blood from the heart to function. It needs enough blood supply from the heart to function. And the blood supply coming from the blood supply coming from the heart is not enough. What happens? It raises an alarm, it complains. What is happening? I am not getting enough blood from the heart. It complains, like, it raises an alarm, and the heart will like, I am pumping enough blood. What is happening? But it is because of the resistance. Those arrows, those vessels are so narrow that it can't get there on time to deliver the amount of blood required for this organ to function. And what happens? The heart, because of that, keep pumping at a much higher pressure to meet the needs of this organ. And when that happens, there can be a rupture. The artery can get to tear. It can rupture and a major bleed. And most things is that most times this arteries get ruptured in the brain and it can cause severe hemorrhagic stroke. So I just gave a brief description of what hypertension can actually cause in physiological aspects. And then we can look at, I talked about stroke, I talked about hemorrhagic stroke, I talked about poor organ function. The organs of the body will not be able to meet their functions actually because they are not getting enough blood supply from the heart. And it is because of resistance from the peripheral vessels. So there are so many other complications, but these are the major ones that we see in our everyday life actually. Stroke, and then we can now look at the minor complications. We see headache at the back of the head. We see dizziness. We see blood vision. These are the complications, minor complications that can occur as a result of hypertension. And we see shortness of breath. Now, for example, how does shortness of breath happen? If the kidney doesn't get enough blood to function, there is retained fluid in the body. And when there is retained fluid in the body, it spreads to the pulmonary area. It spreads to the lungs and the pulmonary region. And then when the lungs are wet, there will be shortness of breath. There will be poor gaseous exchange, stuff like that happen, and then you see shortness of breath. So these things are mainly physiological in the body. So there are lots of complications that we can see from hypertension. And many people have different complications based on the severity of their own hypertension. So, but headache is one of them, a severe complication at the back of the head. Stroke, increased peripheral resistance, poor organ function. These are the things that we can see as hypertensive complications here.
As I hear you speaking, my mind is like, it's literally high blood pressure. It's just that the blood pressure is at a specific, you call them the peripheral veins, and then now it causes us to have the infections because it is not getting to the right channels properly. So it's literally high blood. Like I have never thought about it that way. Like it's literally high blood pressure, and I think maybe hypertension is not easily understandable by somebody who is not into the medicine sector. But actually it's dawning on me right now that some of these science medicated names are actually easy to understand. It's just that
you can carefully look at it, like when you get hypertension, hypertension. And if you even look at the hypertension.
Once you've separated them, it's more understandable.
So hypertension, like I said in the beginning, it's old as man, and if you don't know it as hypertension, you know it as high BP or high blood pressure. So that's it.
Hey, because for me, I think there's a time when I asked you, is there a difference between the two? Because I'm more familiar with the high blood pressure. And then I've had like some people who have been in this situation. You find, yes, they've had maybe high blood pressure for a while. And then it gets to a point where they're being told their heart is enlarged as a result of high blood pressure. How is this maybe condition or complication severe, or how does it get there?
Okay, well, I would say high blood pressure has nothing to do basically with the structural part of the heart, like how big the heart will be. There are majorly, when you talk about enlargement of the heart, it's a chronic cardiovascular problem, which can be I wouldn't say genetic, but it can be from birth. It can be a structural defect. It's more of a structural problem than when it is being caused by a physiological thing. Like, from a logical point of view, one can say that because the pressure on the heart is big, or maybe there's high blood pressure, you tend to increase the size of the heart. No, it doesn't work like that. But logically one can think that the pressure or how high the blood pressure is can determine the size of the heart. If it's like that, those persons that have 200, you can see their hearts start bulging out. No, I'm just saying, like, if we are being logical, we can see that somebody with a high blood pressure of 250, you look at the chest and you say, oh, the blood pressure is already making the heart come out of it. But from logical point of view, yes, one can think that way, but in science, physiologically, it has no relation. So enlarged heart is there as a structural problem when it comes to cardiovascular diseases, and hypertension is also there. It is blood itself, the pressure that is being exerted on the arteries, the wall of the arteries. This is blood pressure. Then we can now say when it's high and when it's low is due to when the cardiac output is high, or when there's increased peripheral resistance, or how narrowed the arteries are, that will determine if the pressure will be high, the pressure will be normal or low. So this is it.
And now, how do I get to be diagnosed with this?
Of hypertension?
Yes.
Well, like from the beginning, we said hypertension is a silent killer. It's a silent killer because you might be here, you don't know, and you have a very high blood pressure. It's not. It's the one we say God forbid, but it's not a God forbid thing. It's not a God forbid situation. I'll give you an example. When I was in my third year in the university, there was I was resuming school from break, and this particular day I started having this. I was feeling somehow. I wasn't having a particular symptom, but I know I wasn't feeling so good. I just came back to school. Most of my friends I had in school who were academic staffs, and were like, oh, I came back, I went to visit, how are you doing? My break was, because it was a really long break. And I went to, see how they are faring over the break, and I was feeling somehow, and it was around the hospital area. So I went into the clinic and like, okay, can my blood pressure be checked, please? Because I just feel somehow. I don't have a particular symptom, but I just feel very different. And I went there only for them to check my blood pressure, and I'm having a blood pressure of over 200. It was too, and the nurse looked at me and asked me, did you walk to this place, or were you literally lifted to this place? I was like, I walked to this place. She said that I'm not leaving this place, that I have to be admitted. Because she's seen a blood pressure of 200 over, and that's hypertensive crisis.
What is the normal one? Okay,
we have a normal range of 120 to 80, 120, but it's very difficult to see 120, 80 exactly. That is why the World Health Organization has categorized blood pressure into different stages. So we have the stage 1, stage 2, stage 3, and of course we have hypertensive crisis. So now for normal blood pressure, we can see 120 over 80. Then if you want to see stage 1 hypertension, we look at blood pressure that are from 129 to 139, and then the diastolic we see from 89 to like 99. And then we look at the second stage for those that have stage 2 hypertension. We look at the blood pressure from 140 to 159, and then for systolic, and then for diastolic we have from 90 to 99, right? Yes. And then we look at stage 3 hypertension. We see from 160 to 179, and then for diastolic we see from 100 to 109, and then for hypertensive crisis we look at above 180 to 200, and then for diastolic we see above 110. So hypertension we have the systolic and the diastolic. The systolic blood pressure is when the heart contracts to send blood, and then the diastolic is when the heart relaxes to receive blood. So that is systolic and diastolic. That's why we have two of them. So each of them have their range. So you can now see that when someone gets to check the blood pressure, you can now know where you fall under. If it's like a stage 1 hypertension, for sometimes stage 1 hypertension, you don't need to do anything about it, because it could be as a result of maybe some stressful activities during the day that happened, and probably it made it to just step up a bit. But if this person is not a naturally hypertensive patient, that can just be elevated because of stress. And then probably when the person goes back to have a good rest and they think he can come back to normal. So to diagnose hypertension now, you might not really see these symptoms except you check.
Going back to that story, you were at 200.
Yeah, okay, back to the story. I was at 200 now, and what does the nurse? The nurse said I have to stay back there. I don't have to go anywhere. That I have to be placed on some medications because this is severe hypertensive crisis. Because when you have a systolic pressure of about 200, And that was why she asked me, did you walk to the And
Yes.
most times people can just go into unconscious state like that. Because imagine I didn't just have that feeling and go to the hospital. And maybe I would just be walking back and then like that I would just fall. So many people, it has happened to so many people.
Yeah.
You just see them walking and then they fall, and if they don't have good medical care, and you can see these persons can literally die from there. But when I went to the hospital, she checked the blood pressure and it was over 200. I had to take a bed. I had to take a bed in the hospital, even though I didn't plan for it. And I don't like being to the hospital. In as much as I don't like being on the hospital bed, but I enjoy taking care of patients. I don't like being there. I don't like being in that position. So I was there, and the doctor came, and we started some medications, and unfortunately, it had actually from what happened the next day, I got to notice that this thing has actually been high, persisted for a very long time. And because I had no symptom about it, it just kept on progressing. And that could actually lead to what we call transient ischemic attack. It's a type of stroke, but it occurs just for days. Transient ischemic attack. So that happened, and I started taking some medications for that. And after some checkups, I found out that one of the major causes was as a result of increased cholesterol. The cholesterol in the body was so high that at some point some fat deposits blocked the arteries and the veins where this blood are supposed to pass freely. So there is increased resistance, there's increased peripheral resistance on the arteries, on the blood vessels, and then that was what caused So I started taking some medications, and after some time it was actually better. So that was what happened. So why am I saying this is hypertension can be asymptomatic, like I said in the beginning. Most times you don't feel the symptom, it just happens. And another way is when you go to the hospital and you check with the blood pressure measuring device. We have there are so many types. There are so many portable ones. That's why most times I advise my patients who I feel like would have this to get the portable device and keep at home. You can be checking it every morning, every evening, every day. You can do it every morning, you can do it only in the evening. So it's a very important routine to monitor the progression, to know when it's going up, when it's coming down, when it's now a hypertensive crisis, when you need to see a doctor, when you need to see a cardiologist. So these are the things that people do to diagnose themselves of hypertension. Then secondly, you can also diagnose from the symptoms that I already mentioned, the minor complications of dizziness, headache at the back of the head, and most importantly, that's where the headache occurs at the back of the head. You see dizziness, shortness of breath, and you see blurred vision, and so these are the little complications that one can see. That's why when I see a patient comes up with these symptoms and tell me I'm feeling dizzy, I'm having shortness of breath, I'm having headache, I say, okay, let's check the vital signs. We see the blood pressure. And sometimes these symptoms are because the blood pressure is high. And so we try to bring it down. So these are the little symptoms that way you can diagnose hypertension, basically.
When you were speaking about how you went to the to the doctor, at least you had the idea that if I am feeling this way, then maybe there could be something I need. But you see, most of us people, you just feel this way, but you don't know what is this way. Like, let me just take a painkiller and I'll be fine and stressed, and then it's fatigue. You just give it names, burnout, fatigue. Let me just throw in names. We take the painkillers, we just rest, and the next day you wake up feeling okay.
So many times it has happened actually. You see someone sleep and wake up with one-sided paralysis. That's like a partial stroke. And it's because of persistent hypertension, you see. This hypertension must have given sign during the day, and it was neglected, and went to bed, and you wake up in the morning, you see that the limbs are affected, you can't move. And it's severe partial stroke, So all these things are things people need to take into consideration actually, because health is really important. I told you it was one of the things that keeps me going. It's something that inspires me a lot. So I really have passion for it, and I try to speak as many people. I speak to as many people as I can reach out to. Like, you have to take care of this. You have to.
And that is why we have you here.
I do my best to talk about it, and that's it.
And also you said that it is 95% secondary.
95% primary
and 5% secondary. And in the 95% you talk about things like how we live our lifestyles. So maybe you can just take us back. Maybe you tell us what are these lifestyle modifications that we need to look into so that we can be able to avoid this hypertension. Because somebody will be like, how much alcohol is too much? How much alcohol is good for the body so that I don't get to that next level?
Okay. Alcohol is a different topic on its own. But I will say this.
Yeah.
Most persons might try to bring up studies to show that alcohol has some positive effect in the body. Fine and good. But the truth of the matter is, alcohol has negative effects in the body. So, but then if I'm to choose between to take the positive and the negative when it comes to alcohol, I rather remain on the negative side. Meaning, I rather not take alcohol at all. Rather it have a negative effect on my body than take when it probably have both a positive and a negative effect on my body. So now, alcohol has its effects when it's in excess in the body. So I cannot say this is the much amount of alcohol you take or this you take less. But know that for every alcohol you take, it has an effect on the liver. The liver cells die. That is one thing people have to know. It is clear that alcohol kills the liver cells. So for every alcohol you take, it affects the liver cells. So whether you take high or you take low, it is a known fact that alcohol affects the liver cells. And then when you talk about the positive aspect of alcohol, I really wouldn't want to say that there is a proven fact that alcohol has positive effects. But I rather alcohol not give me both a positive and a negative effect. I rather just be there.
Yes.
You understand?
Yes.
So now we look at other lifestyle modification, exercise. Exercise is really very important. I told you that one of the things I can't do without is football. I play football and I watch football. I think I even play more than I watch because I actually play football every week and sometimes once in 2 weeks as well. But I really do exercise. Sometimes I can take up walking to like instead of taking a bus or driving to a place, I can just rather walk. Or sometimes I can just take a walk in the evening. These exercises have good effects on the body actually. It helps you to maintain good mobility. Number one. Apart from that, it helps you to keep this, it helps you to burn this cholesterol, burn these fats that are accumulated on the vessels and all. So exercise, naturally, it is a good way of maintaining proper health. Then we now start to relate it to hypertension. So now we can relate hypertension and exercise in terms of those who are obese or those who have a high body mass index. There's a score we use to rate those who are obese. That's the BMI, the body mass index. So when your BMI is above a certain level, you can say that you are obese. So when you do exercise regularly, and you also know we talked about obesity as one of the causes and risk factors of hypertension. So for people like that, they need to exercise daily or exercise whenever they get the opportunity, but it has to be frequent so that you can limit the chances of having persistent blood pressure. So the blood pressure can be there. That was why when I started, I said hypertension literally has no cure, but then it can be managed. It can be managed in such a way that you don't get to have these symptoms. Or even if you're going to have symptoms, it's going to be very less, very minimal. Or your own hypertension can be at the first stage when you don't encounter so many symptoms or when you don't predispose yourself to more complications like stroke. So exercise strikes that balance actually. So that is for exercise. Then dieting. When I talked about dieting the first time, I was like, I talk about dieting. Sodium intake, food that contain so much sodium. For sodium, I can just say salt. For those who might not really know what sodium is, salt. Too much salt in the food. Actually, these are things that can actually increase your chances of having so much hypertension. So basically, when we look at the lifestyle, we look at dietary approach, food that don't contain so much sodium. Actually, you try to eat food that don't have those so much because there's a person that actually likes salty food. There's people that like salty. Most of this chips, most of this snack that have lots of salty.
Not around the maybe
So speak for yourself.
Okay.
So most of those food contents actually, and there are some food contents that have much sodium content that you even know. You can even imagine, but they have so much salt content. Those food needs to be avoided. Then lifestyle in terms of smoking and alcohol. So basically, these are the lifestyle modifications that one need to adapt to, and regular exercises, like in order to maintain a good blood pressure, actually, or that would not increase your chances of getting to a hypertensive crisis or having persistent high blood pressure. So these are the things that we look at actually. Yeah.
So when it comes to salt, you've spoken about too much salt. There are people who I normally see them recommending sea salt.
Sea salt?
Yeah. I don't know, they say it's better than the normal salt. I don't know what's your opinion.
I really wouldn't say anything about that, but basically from science point of view, from physiological point of view, I've talked about what sodium does in the kidney and what happens in the body basically. Now, you see someone who is having hypertension, that you know that the organs are barely receiving enough blood. The organ, now you know that the kidney filters most of these things we take. The sodium, because if you look at the kidney, one of the functions of the kidney is filtration. We look at secretion, we look at reabsorption. These are functions of the kidney actually, of the nephron. So if the kidney is not getting enough blood to filter most of these contents we take, example, this sodium that people recommend and people take, if the kidney is not having enough blood to do these things, there is retention of sodium in the body. And where there is sodium, there is water. It's inevitable. Where there is sodium, there is water. So there is fluid overload. It can spread to the chest, it can spread to the heart, anywhere. When it spread to the chest, the lungs, it causes shortness of breath because now the lungs are wet. When it spread to the heart, it causes its own complications. So that is why sodium is actually not good for someone who is literally having these signs of hypertension or is a potential hypertensive patient. Because I know people today, and most of our aged people who don't take salty food at all. You can look at their food. There is little or no salt in their food, and they do this because they don't want those complications. They don't want these problems actually. So that's it.
So how can we manage like this condition apart from lifestyle modification? Maybe in terms of the medical treatment, how do we manage it?
Okay, well, I was going to talk about pharmacological, which is managing hypertension with drugs, and non-pharmacological. But we've already talked about the non-pharmacological, which is the lifestyle modification. So now when it comes to drugs, they have classes of drugs that you can use for hypertension. And basically these classes of drugs are drugs that can be given or prescribed by the doctor itself. You have to see a cardiologist or you see a healthcare professional. They look at your situation and know the best classes of drug that can be given to you. Now, I also see people most times when there is this popular drug or popular hypertensive medication that people will like say, "Oh, I took this one. You can take it. You can try it." Now, there are people that have hypertension with increased heart rate, which is tachycardia. In their own case, these people need both a beta blocker, which has an effect on the heart rate, and some other classes of antihypertensive medication combined together. Do you understand? There are some people that have hypertension without increased heart rate, meaning they are not tachycardic. They don't have high heart rates, but they have hypertension. Their medication is going to be different from someone who has hypertension plus tachycardia. So in this case now, you see that they need to combine these drugs to give to the person who has high rates, high heart rates, and high blood pressure. Has a different drug from someone who has only hypertension. So, but some people were like, "Oh, this person has taken this drug, it works for the person, probably it will work for me." No, it doesn't work like that. It can bring down the blood pressure, but not the heart rate. And when the heart rate is still high, there is still probability that the blood pressure still goes up again, because the heart is pumping this blood into the vessels at a very high rate. So you can't bring down the blood pressure alone without bringing down the heart rate. Actually. So that's why we have classes of drug. I can list them. We have the beta blockers. These are drugs that have effects on the heart rate, alongside the blood pressure as well. We have the ACE inhibitors. These are the angiotensin converting enzyme. We have the ARBS. We have the calcium channel blockers. We have the alpha blockers. these are different classes of antihypertensive drugs, which can also be prescribed or recommended by a healthcare professional or by a doctor. So basically, you need to see a doctor, you need to go to the hospital. They look at your case, they look at the level where this hypertension is, and know the class of drug that is suitable for you. So people make this mistake. They feel like, oh, this person had hypertension, he took this drug and he's okay. And for me personally, I have to take the same drug. Why? So in some cases it works, yes, but then it has to be recommended. It has to come from a cardiologist. If not a cardiologist, a doctor can see you, or any healthcare professional who is licensed to give prescription in terms of antihypertensive medications can give these drugs to you. So, but other than that, prescription of antihypertensive medication is actually very risky because we are different. We can have different stages, and there are times when you don't give some antihypertensive drug because it is going to bring down the blood pressure to a very low rate. So some person might be having hypertensive crisis and take a particular hypertensive drug, and you that has just probably like a stage 2 hypertension, take that same drug, it gets so down that it becomes hypertensive, it becomes lower than normal. So you need to take a drug that will balance your own state of hypertension. So that's why when you know that you have chances of having hypertension, you look at the progression. How do you look at the progression of hypertension? You monitor the hypertension. You can be monitoring it every morning, every evening, or every day. You check your blood pressure. We look at the progression. How is it progressing? Is it something that you look at your daily activity? These are the things that the doctor or the healthcare professional will get from you as an information and say that, okay, this is the best medication that works for you. So that is it in terms of medication. So I can't list all the drugs and say, go take this one or go take this one. You have to know your stage, know your own problem before a particular medication can be prescribed for you. But the non-pharmacological aspect, which is a lifetime medication, everybody can do that. Everybody can do exercise, modify their diets, choose if they are to quit alcohol or smoking or not, because it's left for the person to decide. So that's it actually. Thank you.
You just actually mentioned something about hypertension. Would you just maybe briefly touch on it? Because most of us really focus on the hypertension, but I believe that those people who also suffer from now the low blood pressure, and I feel like it's riskier also.
Well,
I don't know, you can just touch on it briefly before we continue with hypertension.
Low blood pressure is like the name sounds, low blood pressure. Low, or instead of hypertension now it's hypotension. So it's no longer hypertension, it is hypotension, low blood pressure. Basically, it's when the blood pressure is lower than normal. So in this case, we also have symptoms like, but the symptoms are much more severe, and you can see situations like going into unconscious state. Even in hypertension, there are times where these people go into unconscious state. That's what we call the cardiogenic shock. But in hypertension, we have situations like that can also put someone in an unconscious state. And things that can cause hypertension, we look at low cardiac outputs. We look at maybe when there is a severe bleeding, maybe we see burns, or we see like an accident, a trauma, and the person is bleeding out a lot. You see the blood pressure is dropping, or it can also be as a result of some other chronic heart, chronic organ problem. It can be the kidney, it can be the brain, it can be metabolic. When I mean metabolic, it can be hormonal as well. So these are the things that can cause hypertension. Hypertension is actually very bad because in hypertension, of course, it's obvious, people know it, people can manage it, people can take care of it. But in low blood pressure, there are little knowledge about it. People don't really know. In those cases, what do we do? How do we go about this? But there are also medications that can also be given for that as well. And people that have low blood pressure, I believe, have doctors and cardiologists that they work with You understand?
Yeah.
And if it occurs, and most times it occurs in chronic situations. This person is already in the hospital. Sometimes it can be as a result of other problems that comes up, and like I said, an accident. Of course, someone who is having an accident will be in the hospital. So those can be managed over time. You get, and then there are some people that also live with low blood pressure as well. There's some people that their blood pressure is always on the low side, not on the high side. So those people have their cardiologists, they have their doctors that they visit to see to work on those problems. But low blood pressure is also as bad as hypertension. But I think in low blood pressure we have much minimal cases, and it's as a result of much problems that occurs in the body, and people who are really in the hospital, people who are already going through some other metabolic and organ problems, so that faces this low blood pressure. And then, of course, when some medications are given in a very maybe medications are being abused, like you abuse hypertensive medication now, it can bring down the blood pressure so much. So that is it. So low blood pressure is also very broad. It's something we can also
we can do it.
Talk about on.
But me, I'm just thinking, it's not that now we do the opposite of what the high blood pressure people are doing. That if it is maybe lesser salt, we now take more. Like not doing the opposite.
Okay, no. That you're being logical with that.
To bring it to normal.
You don't have to do the exact opposite of it. No, it's totally different. Physiologically, it's a totally different thing altogether. So you can't say it is because you took less alcohol that you have low blood pressure. But that let me go and take more alcohol. No, no, it doesn't work like that. Actually, you say salt. You say okay, I'm going to finish one packet of salt this week because no, it doesn't work like that. But from a logical point of view, one might think like that, but no, it doesn't work like that. Yeah.
And now, because we don't want to get ourselves in this situation where you're just walking and you maybe just fall down, what are some of the prevention strategies that you think people should take?
In terms of hypertension, well, these are relatable actually. Relatable because if you look at the primary causes, you look at the lifestyle modification, both of them combined together are preventive measures, are preventive strategies.
Yeah.
So these are the things we look at as preventive strategies. Now, genetically, it cannot be, there's nothing that can be done about it because it is in the gene. The parents had it and by virtue of that, you already have the hypertension. But then, what you can do in terms of genetic factor is trying to limit the increase. By limiting the increase, you have to do most of these lifestyle modifications, or because there are some persons who don't even live a sedentary lifestyle, but they have hypertension because of genetic factor.
Yes.
In this case now, they have to manage it with medical treatment and of course, still the same lifestyle modification. For example, exercise, daily exercise. If they're on the big side, they try to exercise more often to see that they reduce the prevalence of this hypertension or to prevent it from being so high persistently. So from genetic point of view, and people who don't even live sedentary lifestyle, you have to manage it. How do you manage it? With exercise. Try not to get yourself in situations like that, like having a very high body mass index, or be someone who don't even exercise or don't even have medications you take for this hypertension. So from genetic point of view, we can look at it as a management or a preventive strategy for that. Then other ones are, you look at your diet, you look at your stress, this level of stress. Because there's a person that don't mind, they can go on for weeks without having proper rest. And you see this persistent increase in blood pressure, and sometimes it can be emotional as well. Most of these stressors, things that make you think a lot. You see the cardiac output becomes so high, and it causes much hypertension. So generally, there is something I usually say, that you are the best security when it comes to your health. No other person can take care of you than you yourself, actually. So no matter how you try, or we try in the hospital to even look at these patients or to help them, we can't do more than they do for themselves. So that's why sometimes you even have a patient who is having severe hypertensive crisis, and because this person is already addicted to smoking, he still wants to smoke. So, like I said, you can, most of the times you can only advise, most of the times you can only try, and sometimes you can actually go against medical advice to do what they feel like they want to do. So, like I said, you are the best security to your health. So no one can actually do more for you than you do for yourself. So these preventive strategies, I believe, I've mentioned from the courses, primary courses, and also talked about it from the lifestyle modifications. And these are the things that you put together, you see as a preventive strategy for hypertension. Yeah, that's it.
That's really impressive, and I'm so glad you covered it extensively.
Yeah.
And we are coming to the end of the show. What would be your last maybe advice to our viewers regarding the entire hypertension condition?
Well, whether you're hypertensive or not, always check your blood pressure regularly. There are some portable hypertensive devices that you can use to monitor your hypertension. They're called the oscillometry sphygmomanometer. They are half automated and there's full automated. We have the Mercury, we have the anaerobic, we have the Android, we also have the oscillometry. These ones are just very portable. You can put it on your wrist, you just press it and it reads your blood pressure. You can do it in the morning, you can do it maybe for people who know that they are not hypertensive, you can, but at least every week make sure you have an update on this is what my blood pressure was this week or is this week. And there are people that have this high energetic job task. People that do lots of strange jobs that take lots of physical activities. That you know that you're always on the stress side. Your stress level is so high. You need to check your blood pressure also as well. You need to check it to know the progression. When is it growing? When is it coming? Like that. Now, if you know that you have this hypertension in your family, that your mother or your father or even previous generations once suffered hypertension, you are a potential hypertensive candidate. So in this case, now you have to watch the things you eat. You have to exercise daily. You have to look at these risk factors and try and see how you can position yourself properly so you don't get affected by it. So these are the things I would say. But number one is check your blood pressure regularly. If you're a blood hypertensive patient or not, it is your duty to always know the progression of your blood pressure, to know at what rate it is. So it's very important. So this is what I have to say to viewers out there. Check your blood pressure regularly. Because hypertension is a silent killer. It doesn't come, it doesn't tell you, it does not. Most times you are symptomatic, it can just happen. So the only way you can actually get it is if you check your blood pressure regularly.
Regularly is the word. Thank you so much for honoring our invite, and maybe where can people find you on social media?
Chimezie official. It's my Instagram handle. It's for now, and then on Facebook, it's my full name, Umejiego Chimezie. It's actually very long. Chimezie official is okay for Instagram. Yeah, it's a personal blog where I intend to, give most of these healthy tips on what people can actually do basically to maintain. Because personally, for me, I shared my experience of how I had a hypertensive crisis and only for me to understand that it was a transient ischemic attack only after some medical tests have been done. So this is like an experience. I've experienced it and I know what it feels like. So on daily basis, I intend to put up articles, to put up videos and things that can help the viewers to know about their health and obtain a very good health.
Wow, that's very impressive. Make sure you comment and also follow his page, as we'll put in the bio, and share also and give your comments as well. So until next time.
Bye.